8 warning signs and symptoms of breast cancer. Breast cancer is a serious health concern affecting millions of people worldwide. It is crucial to be aware of the early warning signs and symptoms, as catching it early can greatly improve chances of successful treatment. Understanding these signs can empower individuals to take action and seek medical attention promptly. In this video, we'll outline 8 warning signs and symptoms of breast cancer, helping you to stay informed and proactive about your health. Before we start, make sure you subscribe to our channel and press the bell icon to get regular updates. Let's get started. Number 1. Changes to the skin's texture. Breast cancer can bring about alterations in the skin, leading to different textures. One noticeable change is the development of scaly skin around the nipple and areola. It might feel similar to sunburned or excessively dry skin. Additionally, there can be thickening of the skin in various areas of the breast. These alterations might provoke itching, which some people may link with breast cancer, although it's not a common symptom associated with the condition. Skin transformations like nipple scaling could indicate Paget's disease, a rare type of breast cancer. This condition warrants attention and further evaluation. Furthermore, skin thickening and changes in texture might signify inflammatory breast cancer, which requires prompt medical attention for diagnosis and treatment. It's important to note that texture changes can also manifest due to benign skin conditions such as dermatitis and eczema. These conditions, while not cancerous, can still cause discomfort and require appropriate management. Number 2. Nipple discharge. When someone notices fluid coming out of their nipple, it can vary in consistency and color. The discharge might be thin or thick and could range in color from clear to milky, yellow, green, or even bloody. Typically, this discharge happens from only one nipple, but in certain cases where both breasts are affected by cancer, it could occur from both. For individuals who are breastfeeding, having a milky discharge from the nipples is normal. However, if there's any other type of discharge, it's essential to reach out to a doctor for further evaluation and guidance. While most nipple discharge is harmless and not indicative of cancer, it is crucial to pay attention to certain characteristics that could suggest otherwise. A concerning sign is if the discharge is bloody, affects only one nipple, and occurs spontaneously without any manipulation or stimulation. Besides breast cancer, other factors can also lead to nipple discharge. These may include the use of birth control methods, certain medications, or infections. It's important to consider these possibilities and discuss any concerns with a healthcare professional. Number 3. Skin dimpling. Skin dimpling, which is when the skin appears puckered or has a slightly bumpy texture, can sometimes indicate a serious health concern known as inflammatory breast cancer. This type of breast cancer is particularly aggressive and requires prompt attention. The presence of cancer cells in the breast can lead to a buildup of lymph fluid, resulting in swelling. Alongside this swelling, skin dimpling or a pitted appearance may become noticeable. It's crucial for anyone who observes skin dimpling to consult with a doctor without delay. Medical professionals often refer to this change in the skin's appearance as peau de reine, a term borrowed from French that means skin of an orange. The comparison is drawn because the dimpled skin resembles the textured surface of an orange. Additionally, individuals may experience other accompanying symptoms, such as erythema, redness, or edema, swelling, of the breast. These symptoms together may indicate the presence of inflammatory breast cancer, reinforcing the importance of seeking medical advice promptly for proper evaluation and treatment. Number 4. Lymph node changes. Lymph nodes play an important role in our body's defense system. These small, rounded collections of immune system tissue work like filters, removing harmful substances such as bacteria, viruses, and cancer cells from the fluid that flows through them. When cancer cells break away from the breast, they often travel to nearby lymph nodes, particularly those located in the underarm region on the same side as the affected breast. This can result in swelling in the armpit area, indicating potential involvement of the lymph nodes in the spread of cancer. In addition to swelling in the armpit, swollen lymph nodes may also be noticed around the collarbone. Typically, they feel like small, firm lumps and may be tender when touched. It's important to note that swollen lymph nodes can also be caused by factors unrelated to cancer, such as breast infections or other illnesses. Therefore, individuals need to consult a doctor if they notice any changes in their lymph nodes or breast tissue. Number 5. Breast or nipple pain. Breast cancer can bring about alterations in the skin cells, resulting in sensations of pain, tenderness, and discomfort within the breast area. These changes might manifest in various ways, potentially causing individuals to experience discomfort. Notably, if a lump is present, it might not necessarily be accompanied by pain. While breast cancer typically doesn't present with pain, it remains crucial not to overlook any signs or symptoms that could potentially indicate the presence of breast cancer. Vigilance and timely attention to any unusual changes in the breast can significantly aid in early detection and subsequent treatment. For some individuals, the discomfort associated with breast cancer may be described as a burning sensation coupled with tenderness. These sensations can vary in intensity and may prompt individuals to seek medical evaluation and assistance. Number 6. Nipple retraction or inversion. Breast cancer is a serious health concern that can lead to various changes in the body, particularly in the breast tissue. One such change involves alterations in the cells behind the nipple. These changes can manifest in different ways, such as the nipple inverting or reversing inward into the breast. Additionally, the size of the nipple may appear different due to these cellular changes. It's important to note that changes in the appearance of the nipples can sometimes occur during ovulation or other phases of the menstrual cycle. Number 7. Swelling. In breast cancer, a specific area within the breast may experience swelling. This swelling can alter the appearance and size of the affected breast. While it's common for individuals to have slight differences in breast size normally, the swelling associated with breast cancer often leads to a noticeable change from their usual breast size. This change can be significant enough to distinguish between the affected breast and the other one. Moreover, apart from the change in size, individuals might also notice that the skin around the affected area feels tight. This tightness can be attributed to the swelling caused by breast cancer. It's important to pay attention to such changes in the breasts as they could be indicative of underlying health issues, including breast cancer. Regular self-examinations and seeking medical advice if any abnormalities are noticed are crucial steps in detecting and addressing breast health concerns early on. Number 8. Changes in breast size. It's quite common for people to notice that their breasts aren't the same size, and that's normal. But when one breast starts getting noticeably bigger without any clear reason, it might be a signal of something more serious, like breast cancer. When we talk about changes in breast size, it is important to note that it could be linked to different types of breast cancer. According to the National Cancer Institute, a sudden and significant increase in breast size might be a warning sign of a particular type called inflammatory breast cancer. This type is pretty rare but moves quickly and aggressively. So if someone notices that one or both of their breasts seem to be getting larger, it's a good idea to reach out to a doctor for advice. They can help figure out what's going on and whether further investigation or treatment might be necessary. Taking action early can make a big difference in catching any potential issues. That's all for now. I hope you found the video informative. If you have any questions, you can ask in the comments section below. Like and share the video and follow us for more updates. Thanks for watching.